So guys, as you can tell from the title of my YouTube video, I'm going in for jaw surgery. I'm booked in for tomorrow, the 1st of March, and as you guys may not be able to see, or may not be able to see, I have a pretty excessive lower jaw, and tomorrow they're moving it back 8 millimeters, only on the lower jaw. So I'll show you my profile. So from the front and from the sides. So I just wanted to give you guys a bit of information on my surgery, especially for those who are deciding whether or not they want to have it done, particularly younger people, and as well as people in Australia. In my story, I've had braces previously, and as a result, my pre-surgery orthodontics has only lasted for 5 months. And but to be honest, this was the hardest thing to get used to again. I'm 20 now, and I feel like I've gone back to school. But really, that's all in your head. No one really cares except you. So before I had my braces on, my orthodontist said that I had an excessively developing lower jaw, and as such he referred me to a maxillofacial surgeon, and he painted the picture of surgery, the only way to fix it. I knew I wanted it done instantly, and as for many of you guys out there, I'm sure it was because of the way you feel, you look. It certainly was. I was getting self-conscious about it, walking past mirrors, looking at my face in every mirror. So like at that time I realized that I needed to get it sorted out. But after 5 months of having the braces on, I've become probably a lot more open-minded, and a lot more less self-conscious about the way I look, rather because I've been like this for such a long time, and everyone has gotten used to it, and no one really mentions anything about it. But I've sort of shifted a focus to how it affects my everyday life rather than how the way I look. You definitely start to notice the little things a bit more. One big one for me is the fact that I always have my mouth open. The jaw bears such a weight. That my mouth is just constantly open. And my mum would always just tell me, to close my mouth it would just be I wouldn't even know that I had it open. It was just open. As well as you notice a lot of the big things. A big thing for me was the impossibility of eating sandwiches. I really like sandwiches, but thinking about it now, I'm really, really keen to eat a sandwich without everything falling on the floor. Being able to bite would be great. So in order to get ready for the surgery, I've had a series of x-rays, orthodontics, but as well I've also had lots of physio on my jaw, to get it up to strength, because it was really weak and just flimsy. I had a lot of cracking and clicking in my jaw, and that's mostly gone. But after those things, what most importantly came was a sleep study and a bone scan. Because if these results didn't come back the way I wanted them, I would either have to change from a single jaw to both jaw surgery, or not have it at all. The sleep study was to test if I could breathe properly, especially if I'm moving the lower jaw back further. It definitely could have massive impacts on the way I sleep, especially sleep and breathe, especially later on in life. I can't remember the term for it. I might remember it later. But as well, the bone scan was there to show whether or not I had fully grown, because if I wasn't fully grown, I wouldn't be able to have the surgery, because the last thing anyone wants to have is to have surgery and then for the jaw, to go back. That would suck, But after all this, it was just simply a matter of taking care of my teeth up until today. The orthodontist said everything went well. Everything has gone well, because I'm still having the surgery tomorrow. So I'm pretty excited, to say the least, and to have a regular jaw and to do all the regular activities without feeling different. I guess. But onto maybe some more important stuff, especially for people in my country. In Australia, I have private health cover. I'm with Medibank Private, and I'm booked into one of the private hospitals in my area. The only fees that I actually had to pay were the surgeon fee and the anaesthetist fee. So the surgeon was around $6,000, and the anaesthetist is only a few $100s. Private health cover covered the rest of the hospital fees and all that, so I didn't have to pay any of them, which is a plus. And other than that, there's not really much to talk about. Unless you guys have any questions, definitely send me them. But hopefully I'll be back in a few weeks with a better bite. Talk to you all again.